Thank you, Dr. Ayler. I just want to make sure everybody can hear me okay?
Yes, we can hear you just fine.
Okay, perfect. So, yeah, my name is Michele Davis. I'm a PGY4 Infectious Disease Fellow here at USF. So we're going to just go through some pandemics and kind of how their effects have been on different countries that have been involved, and kind of some other things that um, show kind of the effect of pandemics even on countries in general. So I don't have any disclosures. So let's first kind of figure out, so what exactly is a pandemic? The World Health Organization defines a pandemic as the worldwide spread of a disease. So right now we're kind of just going to go through a timeline of kind of what our first recorded, or what we think was the first pandemic, and then kind of go through, obviously today we're currently living in a pandemic and dealing with that. So we'll go through a timeline, kind of explain the earlier pandemics, they don't exactly know what was the etiology of a lot of them, but then we'll kind of go through the different pandemics and who they affected, and the extent of the effect on the society. So the first recorded pandemic was in 430 to 435 BC estimated. It occurred during the Peloponnesian War. It affected Athens and passed through Libya, Ethiopia, and Egypt. So this actually weakened the Athenians so much that it was a significant factor in the Spartans' victory over them. It was unclear which disease, but some have hypothesized that it was typhoid fever versus Ebola. One of the Greek historians actually wrote that people who were in good health all of a sudden were attacked by violent heats in the head, redness and inflammation in the eyes, inward parts such as the throat, tongue becoming bloody, emitting an unnatural and fetid breath. So this was actually spread mostly because of overcrowding, due to the Athenians having to take refuge in these long walls, kind of depicted in this picture. Just because of the Spartan army invading, they were pushed into a lot smaller of an area in order to actually live. So the next was roughly estimate 165 to 180 AD, the Antonine Plague. Began with the Huns. It infected the Germans, who then infected the Roman soldiers, and then they brought it back to Rome. Estimated killing of over 5 million people. They're not sure if this possibly was an early appearance of smallpox, but some of the different symptoms that were included were fever, sore throat, diarrhea. Patients, if they lived long enough, had pus-filled sores. 250 AD, Cyprian Plague. It was also named after the first known victim, which is the Christian bishop of Carthage. Estimated to have killed about 5,000 people a day in Rome alone. And the city dwellers fled to the country thinking that they were going to escape the infection, but subsequently further spread. So could have possibly started in Ethiopia, passed through North Africa, Rome, Egypt, and then northwards. And then there had been recurring outbreaks over the next 3 centuries. So these symptoms included diarrhea, vomiting, throat sore, ulcers, fevers, gangrenous hands and feet. Unsure of this etiology as well, but there was, Cyprian himself had written that an excerpt from book, the bowels relax into a constant flux, discharge the bodily strength, and a fire originated in the marrow ferments into the wounds of the fauces, so an area of the mouth. Archaeologists in Egypt actually found remains of some of the victims that were struck down by this plague, and the victims, the bodies were actually burned and covered with lime, because in that time period it was thought that lime could help prevent the disease from spreading. Oops. So in 541 AD, there was the Justinian Plague. First appeared in Egypt, spread throughout Palestine, the Byzantine Empire, and through the Mediterranean. It was actually named after the Emperor Justinian. The plague actually changed the course of the empire because it prevented the Roman Empire from reforming and caused a massive economic struggle. And it was credited to creating like an apocalyptic atmosphere that actually spurred the rapid spread of Christianity during this time. and there were several recurrences over the next 2 centuries. Estimated to eventually kill about 50 million people, 26% of the world population at that time. It's believed that this possibly could be the first significant appearance of the bubonic plague, with enlarged lymph nodes carried by rats and spread by fleas. So the 11th century was kind of the leprosy. Had been around for several ages, but it grew into pandemic in Europe in the Middle Ages. And actually a lot of numerous leprosy-focused hospitals were built to accommodate so many vast number of patients that had come down with this. In that time period, it was believed to be a punishment from God that ran in families and believed led to moral judgments, and they basically ostracized these victims of this disease. So in the 1300s, 1346 to about 53 was the Black Death, responsible for the death of about 1/3 of the world's population, half of Europe's population. It was the second large outbreak of the bubonic plague, possibly started in Asia, moved west in caravans. They hypothesized that it was caused by a strain of Yersinia pestis that's likely extinct today. It entered through Sicily, arrived in the port of Messina, and then spread throughout Europe pretty rapidly. And the dead bodies became so prevalent that many remained rotting on the ground, creating such a stench in the cities. And this actually incapacitated England and France so bad that they called a truce to the war. And the British feudal system collapsed basically during this time because labor became so hard to find. They were trying to increase pay for workers, but it may have contributed to some of the innovation and technological advancement due to the shortage of labor. And then this also kind of ravaged populations in Greenland, and the Vikings were losing the strength to kind of take over the territory that they were trying to explore in North America. So in 1492, the Columbian Exchange. So basically the Spanish arrived into the Caribbean, North America, South America, and diseases along with these ships were passed to the native populations by the Europeans, being smallpox, measles, and bubonic plague. Obviously, the indigenous populations and people of these places had no previous exposure, and it estimated to kill 90% of them dying throughout the North and South continents. It's believed that the Aztec Empire was pretty much destroyed by smallpox infection because it weakened the population so much they weren't able to resist the Spanish colonizers, and it left the farmers unable to produce any of the needed crops. There, in the 16th and 17th centuries, it's estimated that 56 million Native Americans were passed because of different diseases that were brought. And then it also may have altered kind of the Earth's climate because of the vegetation growth on previously tilled land grew more carbon dioxide from the atmosphere and could have caused a cooling event. 1665, we see the Great Plague of London. This was another round of the bubonic plague that led to the death of 20% of London's population. The human death tolls mounted and mass grave sites appeared. They actually thought that cats and dogs were the cause of the spread, so there were hundreds of thousands that were slaughtered to try to prevent that spread. And then this tapered off in the fall of 1666, around the same time as the Great Fire of London, which was another fairly destructive event. This is actually a graph that shows, so the overall deaths in London are the top line, that's the solid line, and then the dotted line underneath is basically showing the amount of deaths from the Great Plague of London between these two in the time period as shown on the upper y-axis, and then the x-axis shows in the thousands. In the 1800s, in 1817, we see the first cholera pandemic that was noted, but this was the first of several cholera pandemics that happened over the next 150 years. It originated in Russia with 1 million people dying, passed along to British soldiers, then to India, estimated killing a few million people. Then the British Empire and its navy spread cholera to Spain, Africa, Indonesia, China, Japan, Italy, Germany, America, killing around 200,000 people. And then, despite a vaccine being created in 1885, the pandemics continued to occur. In 1855, we see what we think is the third plague pandemic. Unsure of some of the earlier pandemics that occurred, if they were due to plague or not, but this is the third recorded. Started in China, spread to India, Hong Kong, claimed about 15 million victims. Initially spread by fleas during a mining boom in Yunnan, and then it was considered a factor in the Parthay and the Tamping rebellions. India faced also substantial casualties, used as an excuse for repressive policies that sparked some revolts against the British, and it was considered active until 1960, when the cases dropped below a couple hundred. In 1875, we see a Fiji measles pandemic. So Fiji ceded to the British Empire, and a royal party actually visited Australia as a gift from Queen Victoria. And during that time, when they arrived, there was a measles outbreak, and that royal party brought the disease back to the island, spreading. And then it was spread further because tribal heads and leaders and police who met them at the port upon their return basically went back to their villages and different places, that spread to basically the entire population of Fiji. That took 1/3 of their population passed from that, totaling 40,000 people. In 1889 was the Russian flu, thought to be the first significant flu pandemic, which started in Siberia, Kazakhstan, traveled to Moscow, and then made its way to Finland and Poland, where it moved to the rest of Europe. By the following year, it had crossed into the ocean in North America and Africa, and estimated 360,000 people died by the end of 1890. In 1918, we see the Spanish flu. So this was an avian-borne flu, estimated 50 million deaths worldwide. It was first observed in Europe, the United States, and parts of Asia, and then spread throughout the world. In July, there was a wire service reports of the flu outbreak in Madrid, which led to it being called the Spanish flu. And then by October, hundreds of thousands of Americans died, so it had spread there to the Americas. And then the flu basically disappeared almost in the summer of 1919, because basically you either developed immunity or you had passed from it. In 1957, we see the Asian flu, which started in Hong Kong, it spread throughout China, and then into the United States. It became widespread also into England. In over 6 months, 14,000 people had died. A second wave followed early in 1958. Estimated total of 1.1 million deaths globally, with 116,000 deaths alone in the U.S. And a vaccine was developed which effectively contained the pandemic. And as you can see on the right, it's believed to have been a reassortment from the H2N2 and the H1N1, avian and human virus. In 1981, we see the HIV/AIDS pandemic, first identified in 1981. AIDS was first observed in American male homosexual communities, believed to have developed from a chimpanzee virus from West Africa in the 20s. Disease moved to Haiti, and then in the 60s and 70s seen in New York and San Francisco. And to date, 35 million people worldwide have died from AIDS. 2003, we see SARS, which was first identified after several months of cases, suspected to have started from bats, spread to cats, and then humans in China. In China initially, then followed by 26 other countries, infecting around over 8,000 people with about over 774 deaths. Quarantine efforts did prove effective because within months this virus was pretty much contained. And this was kind of seen by global health professionals as a wake-up call to improve outbreak responses. So this actually, lessons we learned from that pandemic kind of help keep H1N1, Ebola, and Zika under control as much as possible. And then obviously we're up to our current date. So we are living currently in the pandemic of COVID-19. So on March 11th in 2020, the World Health Organization announced that COVID-19 was officially a pandemic affecting 114 countries in 3 months and infecting over 118,000 people. First reported case was in China on November 17th in 2019, but went unrecognized. 8 more cases appeared in December, and then research had pointed that there was an unknown virus that was causing this. A lot of people learned about COVID-19. There was an ophthalmologist in China, Dr. Li Wanlang, who basically defied the government orders and released safety information to other doctors. Following day, China informed the World Health Organization, and they also charged Li with a crime, who he actually ended up passing from COVID-19 in just over a month later. So obviously without a vaccine available, the virus spread beyond the Chinese borders and pretty much went to every country in the world. And by December of 2020, it had infected more than 75 million people and led to 1.6 million deaths worldwide. So kind of looking at this, looking through our timeline and different pandemics, what have and what can we learn from these pandemics? So a couple things we'll kind of briefly look at are, what are the roles and responsibilities of healthcare workers in these, the consequences to global trade and economics, the challenge of providing equitable access to healthcare resources, and the balance of individual rights versus public welfare. So obviously we're all healthcare workers and we realize our responsibility in this. Obviously we're inevitably on the front lines because we are ethically obligated to provide safe care to our patients. And we do this with the knowledge that we bear a high personal risk of infection, which we all can personally, feel that because of what we've experienced over the past year or so. From a government-wise, they kind of have, these things of looking at the infectious disease as well as the commerce or economics of the country and kind of how that's going to affect them. So obviously international trade and travel has caused spread of pandemics, and has led to a lot of basically the spread is travel and trade. And in the 14th century, the governments of different countries actually recognized this, which different measures have been put in place throughout the years. For example, like, early on with the plague, they actually had ships arriving to the port in Venice were not permitted to dock for 40 days. We saw different things with cruise ships with the coronavirus, different things like that. Obviously, international travel has been halted for a while. But this kind of development in the 14th century also it led to the development of international health regulations by the World Health Organization, and they're still ineffective today. They still kind of need to be updated, but they basically give guides for ship sanitation, hygiene and sanitation in aviation, try to minimizing international spread without interfering with, world trade, transportation, and travel. So this is kind of a depiction. This was in 2003, the spread of polio. So it's kind of just showing international spread from Nigeria initially, as you can see, the concentration in that country, and then the spread into, some of the more in the countries surrounding Nigeria and in Africa, and then over into other countries in the Middle East. This graph also kind of shows, it shows kind of basically 3 pandemics at different time periods. So the yellow is likely thought to be smallpox or measles. Brown is bubonic plague, and the red is the nature of epidemic was unknown. So kind of you can see that, it concentrates around where countries have access to water. A lot of the times where their ports are, this is a high concentration of where international trade and travel would have taken place. And then you can see that because of these different routes, you see the higher concentrations of the diseases and the spread of them due to the international trade and travel. So the other thing is kind of the challenge of providing equitable access to healthcare resources. So a lot of the times there's certain countries or people groups that don't have access to the appropriate vaccines and medications to even treat this. This was seen in meningitis in Africa. Large epidemics were seen in dry seasons from Senegal to Ethiopia. So in the late 90s, Doctors Without Borders, UNICEF, International Federation of Red Cross and Red Crescent Societies, the World Health Organization, they all basically attempted to address this problem. So they pre-purchased and stockpiled vaccines for distribution so that when they actually reached a critical threshold of meningitis cases, then they had access to be able to continue to vaccinate and make sure that it didn't get out of hand. This also occurred with polio in the 1980s. Polio was reported in 125 countries that lacked access to the vaccine. And by 2005, only 4 countries so had not yet interrupted the transmission of the virus. And this was due to the World Health Organization, the CDC, and UNICEF basically providing access to the vaccines throughout the world. And then not even the access, even once they have access, it's also the distribution of the vaccines that we can obviously see is something that we're going through now with COVID-19. And then kind of the last thing is, the balancing of individual rights versus public welfare. So this can be seen with SARS in Hong Kong. When this initially popped up there, they did contact tracing. They basically, their names of the patients and were placed into a police database provided to immigration and prevented any kind of travel. With smallpox, they did an eradication campaign with vaccinations, and they basically did a ring vaccination strategy. So all household members of the affected person, and then they went into any contact of any of those affected person or household members. Obviously, there's things like mandatory thermal scanners, which are a little bit less invasive. Obviously, they do that with influenza and COVID now, and then screening tests for international travel. So it's kind of a balancing of how involved the government gets into, the individual rights, looking at that versus obviously the public welfare. So with that, I'll take any questions or any comments, any kind of discussion anybody has about that.